Okay, let's have short discussion about infertility and how to do the workup of infertility in our setup in Somaliland. Infertility definition is unable to conceive. The couple fail to conceive in 1 year or after 1 year of unprotected sex with a reasonable frequency of intercourse, which means around 3 to 4 times per week in different days. The prevalence of infertility is around 10 to 15% in reproductive age couples, which means that most of the couples are subfertile but not infertile. Infertility, we have two types of infertility, primary infertility and secondary. Primary means those patients or couples who have no conception before. And secondary is those who have period conception or period children, regardless of whether it's abortion or a live birth, but instead of conception. Fertility is chance of getting pregnancy in one cycle, which is 20 to 25%, which is increasing up to 60 to 70% in 6 months and up to 85% in 1 year. And if we add one more year, there may be again another 5% may get pregnant. The etiology of infertility can be shortly summarized into ovulatory dysfunction, which is 27%, the commonest one. Then male factor infertility, tubal and uterine factors of 22%, unexplained infertility of 17%, and other factors or other minor factors of 9%. So to evaluate, we have to evaluate female infertility evaluation and male evaluation. For evaluation of female patients with infertility, we need to have these three evaluations. We need to evaluate their ovulation. Is she ovulating or unovulating? Evaluation of ovarian reserve and evaluation of anatomical abnormalities. So evaluation of ovulation or anovulation, we have different methods, direct and indirect method. To evaluate the anovulation, we can take from history, menstrual pattern, if the menstrual cycles is regular, coming every fixed time, then we can consider this woman is ovulating, especially if the cycles are having the associated minimal symptoms like mood change or mood swings, food cravings, and some mild abdominal cramps. The abdominal pain should not be severe because it will indicate endometriosis. Other thing that we can use for evaluation of ovulation is basal body temperature. The woman may measure her body temperature. Normally, in normal cycle, it's biphasic temperature. Temperature is low in the early part of the cycle or during the follicular phase. Then the luteal phase, it increases. The temperature increases due to progesterone effect in thermoregulatory center. The woman will measure the temperature vaginally or rectal temperature every morning. The vaginal temperature every morning when she wakes up before she gets out of bed, and she will document it in this. It will be drawn like this chart or this curve. Then they will find this biphasic temperature, which means the woman is ovulating. But practically, it's not used for because it needs long time. It needs patient cooperation. There are some factors which can give you false positive or false negative. For example, if the woman is having another cause of fever, for example, infectious things, then their temperature may be different or may be highly elevated in who we may not find this biphasic temperature. The other thing is, if the couples will notice that the biphasic temperature when they reach here after they pass the ovulation, so this will not help the couples who are trying to conceive. The other thing we can use is ovulation prediction kit. It's a measurement that's used from urine, and it's a urinary luteinizing hormone. It's a test is checking the LH hormone from the urine. And the test is begins before 2 to 3 days before the predicted LH search, because first we should predict the ovulation. So the time that we think that the woman will ovulate, 2 to 3 days before that, then she will test daily. And when she gets positive LH search or peak LH search, the ovulation will occur the next day to that. If the woman cannot decide the LH search is positive or not, she can repeat the test again in the same day in the afternoon. Other thing is endometrial biopsy. Endometrial biopsy is not commonly used for evaluation of infertility because it has greater inter-observer and intra-observer variability, but it can be used to diagnose luteal phase defects. The other thing is serum progesterone. Serum progesterone is very important simple test that's available in our setup, which is a measurement of mid-luteal phase progesterone. In progesterone, in luteal phase, especially at day 21 of the cycle, the progesterone should be elevated more than 4 to 6. It means the woman is ovulating. There is ovulation happening. And mostly if it's more than 10, you can diagnose the woman is ovulating. So we can use both to check whether there are drugs. For example, you give a woman a drug for ovulation induction, you can use this to check whether the woman is ovulating, whether your drug is working, or whether normally the woman have ovulated this cycle or not. Other thing is sonography. Sonography to check for ovulation is a transvaginal sonography repeatedly every day during the follicular phase, especially late follicular phase, to see the follicle forming, deforming, growing, then collapse of the follicle, which means this follicle have ovulated. But it's not used commonly in real practice because it needs serial transvaginal ultrasound and it's quite invasive. And there are simple methods that we can check the ovulation. So after we check the ovulation, the other things that we need to check for ovulation, for example, there are some endocrine disorders which can have effects on ovulation, especially the thyroid and prolactin level, because prolactinoma or hyperprolactinemia and both hypo and hyperthyroidism